Good afternoon, everyone, and I would like to thank the organizer and Raghunath sir for inviting me here. So, I will be presenting the data of CNS efficacy of Rezivertinib in advanced NSCLC patients with EGFR T790M mutations, a pooled analysis of two clinical studies. Rezivertinib is a novel third-generation EGFR TKI that has shown systematic and CNS antitumor activities for EGFR T790M mutated advanced NSCLC patients in preclinical studies. And most of the patients develop drug resistance after around 1 year of first or second generation EGFR TKI use. And the most common mechanism of resistance being the development or acquired drug resistance because of T790M mutation, which is reported in more than 50% of the patients. Brain metastasis imply a poor prognosis, especially among the NSCLC patients with EGFR sensitizing mutation, and it has got a high predilection which reaches beyond 50%. Disposition. From the phase 1 study, the Rezivertinib 180 mg per day was determined as the recommended phase 2 dosing, and all the patients who received Rezivertinib more than equal to 180 mg per day dose was considered and determined as a full analysis set. All patients enrolled were required to have enhanced MRI scans for the brain at screening and at following the treatment period. Patients with CNS disease, either measurable or non-measurable by BICR according to RANO-BM, were considered as or designated as a CNS FAS, that is CNS full analysis set, and patients with either one or more measurable CNS lesion were considered as CNS evaluable for response sets. This is baseline characteristics. Median age being 59 and 58 years for FAS and CFAS patients. Most of the patients were less than 65 years of age and female. ECOG performance status being 0 and 1. And exon 19 deletion mutation was seen more commonly in 63 and 60% of the patients respectively, with L858R mutation in 35 and 37% of the patients respectively. Coming to the results, the median duration of Rezivertinib exposure was 8.3 months. In the CFAS subgroup of patients, the CNS overall response rate was 32% and the CNS disease control rate was 42%. The median CNS duration of response being 13.8 months. This is percentage change of tumor size from the baseline in the CNS evaluable for response set. The CNS overall response rate in this subgroup was 68.9% and the CNS disease control rate was 100%. The median CNS depth of response being 52%, ranging from -100, that is complete response, to 16%. Again, the best percentage change from the tumor size from the baseline in the CNS evaluable for response set. This waterfall plot shows the most of the patients had good response, and one patient also had a complete response, that is shown by the red color. This is 3D waterfall plot for BICR SS CNS depth of response by the patient quartile and individual patients with Rezivertinib treatment duration in CNS evaluable for response set. As the patient group which were having more response rate, like if you see on the right hand side of the first figure, more than 75% of the response, they were having the highest treatment duration, the longest treatment duration, which extended beyond 1 year of treatment duration. The CNS PFS in the CNS FAS subset of patients, the median CNS PFS was 16.5 months. And this is a CNS PFS based on the type of EGFR mutation. For patients who were having baseline exon 19 deletion, the median PFS was 15.2 months, and for those who were having baseline EGFR L858R mutation, the median CNS PFS was 16.6 months. Usually we have seen that most of the trials have shown the exon 19 deletion do better as compared to the L858R mutation, but here there was slightly better outcome with the EGFR L858R baseline mutation, however it was non-significant. So this is CNS PFS for baseline tissue EGFR T790M mutation positive with plasma EGFR either being positive or negative. So patients with tissue positive T790M mutation and plasma negative, the median CNS PFS was not calculable, and for those who were having baseline tissue positive T790M mutation and plasma positive as well, the median PFS was 8.2 months, which was statistically significant. So this is the BI-CRSF CNS response in both the main subgroup, that is the CNS full analysis set and CNS evaluable for response set. 12% complete response in CFAS and 2.2% in CEFR, partial response being 20 and 66.7%. The CNS overall response rate was 32% versus 68.9%, and CNS disease control rate being 42 and 100%. Adverse event of Rezivertinib, the most common adverse events which were seen in this pooled analysis was leukopenia, thrombocytopenia and anemia, all ranging more than 20%. Apart from that, rashes and liver enzyme derangement were seen in 10 to 20% of the patient. Other less common side effects seen in less than 10% of the patients were decreased appetite, vomiting, increase in the creatinine, diarrhea, and increase in the CPK level. The conclusion of the pooled analysis was that Rezivertinib showed a promising clinical CNS efficacy in advanced NSCLC patients with EGFR T790M mutation and CNS metastasis. The CNS efficacy with a favorable CNS overall response rate, CNS depth of response, CNS duration of response, CNS progression-free survival, and the safety profile were consistent with the previous publications. The CNS efficacy of Rezivertinib should be further evaluated in further studies. Thank you.